The following segment is presented by Bremo Pharmacy.
I'm sure that when you hear the word osteoporosis, you think that that's something that only the elderly need to be concerned about. No matter your age, though, osteoporosis can affect you. Ann Anderson is here from Bremo Pharmacy. Ann, is it true that we reach our maximum bone strength and density by the time we're age 30?
By the time we're age 30, right. 98% of our bones have reached their peak bone mass.
So from there on out, it's downhill when it comes to bone strength and
Not
density.
necessarily.
Well, osteoporosis is a big problem. A lot of us, though, don't know what osteoporosis even is.
Basically, it's weak, brittle bones that result in fractures, and that's due to a decrease in bone mass. Osteoporosis is a serious disease not to be taken lightly, because if somebody does experience a fracture, a hip fracture, the incidence of death rises by 20%. So certainly something to take seriously.
What are some of the risk factors when thinking about osteoporosis?
Most commonly women. 80% of osteoporosis sufferers are women, but men also get it too. And some of the risk factors are, since it's women, hormone changes.
Right.
Men also, when they have a decrease in testosterone, are at risk for osteoporosis as well. White women and Asian women tend to be at a higher risk. Those who smoke, those who excessively consume alcohol, those who are inactive or who have an inadequate intake of calcium and vitamin D, all those people are at risk, and those are risk factors for developing osteoporosis.
All right, well, the good news is that there are some screening techniques available that we can get done in our 30s and 40s and 50s to make sure that we are doing well with our bone health. What are some of the ways you screen at Bremo Pharmacy?
Yeah, the only way to know your bone health is to get screened. And we have a very simple machine that uses no radiation, and it takes less than a minute. You come in, we ask you to remove your shoe and your sock, and you place your foot on a platform, and in less than a minute you get a score called a T-score, which is a measurement of your bone density. The pharmacist will take that T-score, combine that with a questionnaire assessing your risk factors, and then come up with what your overall risk of osteoporosis is.
Okay, do you have a recommendation for when people should start having this screening done?
Not specifically. Just like you said, 30s, 40s, 50s, it's never too early to know what your bone density is, because the earlier you know and the more you know, the more likely you are to be able to do something about it. Change your lifestyle or get treatment if that's what's appropriate.
Yeah, because there are ways to reverse the effects of osteoporosis and increase your bone health.
Right.
Now, at Bremo Pharmacy, Staples Mill Road location, on Fridays, now through September, free osteoporosis screening.
And just walk-ins on Fridays. We ask that you make an appointment Monday through Thursday just to make sure we've got the staffing. On Friday, we definitely have the staffing, so it's just walk-ins.
All right. Well, that is a great service, again, from Bremo Pharmacy. Don't we love them? Make sure that you get your free osteoporosis screening, and make sure you're up to date on your vaccinations as well. Get all the details at 288-8361.